Hi everyone, I'm Dr. Akhila, consultant, fertility specialist to the hospital Banjara Hills, Hyderabad. Today we're going to talk about the signs and symptoms of infertility. Infertility means that if a couple is trying to conceive for a period of 1 year with uninterrupted intercourse and they're still not able to conceive within a span of 1 year, that's when we call it as infertility. And there are three types of infertility. One is primary, one is secondary, one something we cannot explain, which is called as unexplained infertility. Primary infertility would mean if a couple has never had a pregnancy, that is called as primary, and secondary would mean they've had a previous pregnancy unexplained in spite of trying to figure out all the causes, all the tests have been done, and there's no apparent cause that we can try to come to. That's when we call it as unexplained infertility. Now, what are the different symptoms of infertility? Per se, the main symptom is that they're not getting pregnant. That is the main symptom. Some women can have other symptoms like irregular periods or scanty periods or no periods at all. These are some of the symptoms that they can have, or painful periods, pain during intercourse, or pain in between the cycles. These all can point to certain conditions like endometriosis or fibroids or adenomyosis, PIDs. These are the things. In irregular cycles, we can suspect probably PCO, polycystic ovary, thyroid disorders, disorders wherein prolactin is abnormal. These are some of the symptoms of infertility in women. When it comes to males, uh, certain conditions, certain infections like mumps, chlamydia, gonorrhea, can affect the sperm count and motility as well. Varicocele, where the enlarged tortuous veins on the testes, undescended testes or testicular tumors, cancers in both men and women, uh, exposure to pesticides or chemotherapy, radiotherapy. These are some of the symptoms of infertility in men. Of course, the semen analysis, wherein if there are no symptoms, but the counts are less, or the motility is less, or morphology is poor. These are all symptoms of infertility. Sometimes men with high sugars, diabetes, hypertension, people with depression also may have infertility issues. Um, these are basically the signs and symptoms that we look for infertility in men and women. Any questions, please? That is the first question. How can I know I'm troubled with getting pregnant? So we typically wait for a year if the female is less than 35 years and no other complaints, and they're having a regular unprotected intercourse cycle. And if she's more than 35 years of age, then we wait for a period of 6 months. That is, if there are no other symptoms of irregular periods or painful periods and other symptoms that I have just mentioned, everything is normal. Should there be any problem, you don't need to wait for this 1 year or 6 months. You can consult a fertility specialist. If you have any pre-diagnosed issues like PCO, endometriosis, PID, fibroids, adenomyosis, blocked tubes, etc. Uh, okay. So the blood test that you require would be a thyroid test, a prolactin test, sugar tests, insulin to rule out insulin resistance, Also, because there is facial hair, we may need to look into the testosterone levels, the total testosterone levels, a scan definitely. All this needs to be done. Also, we need to figure out if it's only PCO or if there is any adrenal issue as well. Uh, these are the two things that needs to be looked into. So, more than 35 days, if your period is delayed, then probably we can think of PCO. You need to get a scan done and some blood tests. What can really help you is lifestyle modifications, exercise, and healthy diet. Include more of fruits, nuts, seeds, and vegetables in your diet. Exercise regularly and a sleep of at least 8 hours. All this will help you uh, maintain your, healthy, maintaining a healthy lifestyle can really help you. Apart from this, if you're diagnosed with PCO, metformin can really do wonders to help in fertility. So I think we've answered this question. How can I know I'm trouble with getting pregnant? So we need to do the entire array of blood tests, the scans, the thyroid, prolactin, sugar levels with you, and for your husband, a semen analysis. This is the basic workup that needs to be done based on your AMH levels and the follicular count. We can organize a plan for fertility for you. Importantly, lifestyle. You need to try to lose some weight. Exercise and change in your diet can help you for the same. And um, you definitely can get pregnant, but we need to understand what the problem is and uh, tailor a right treatment plan for you. So, a scan, the basic workup includes a scan, some blood tests, importantly thyroid, prolactin, and sugar tests, and an AMH, and a semen analysis for the husband. This is the basics that we do. This definitely needs to be done. So, IVF is never 100%. Uh, It depends on the quality of the egg and the quality of the sperm. We need to go through the protocol that was used, the injections that were used, and the kind of antioxidants that were given. Also, the trigger that was used and the time at which the pickup was done, how many mature eggs were there, how to improve the number of mature eggs. All this needs to be looked into, and some changes with these injections may help in getting more number of N2s and therefore more number of embryos. Sperm selection also plays a very important role. What is the kind of motility we have and the morphology and the counts that are there? And based on another important test for the husband, which is the DNA fragmentation index, that needs to be done. Based on the results of this, an appropriate sperm selection technique needs to be used. A karyotype of the couple needs to be done, that is to check if there are any genetic conditions involved, which is why we have to failed IVFs. A hysterolaparoscopy, if not previously done, is something we need to look into to check if we've missed out anything. Um, and if two cycles are failed, importantly, we need to test the embryo, something called as pre-genetic testing of the embryo, PGT-A, needs to be done. And if there are any genetic issues, then any other abnormalities need to be checked in the embryo. Also, an endometrial receptive array to check the receptivity of the endometrium may also be considered. Yes, you can definitely get the test done. And though age is the most important factor, uh, but I think, you still can try based on the results. Absolutely. Painful periods could mean endometriosis or PID or fibroid or adenomyosis. Irregular periods would mean PCO or thyroid prolactin disorders. Absent periods would mean, a major hormonal imbalance, um, primary ovarian insufficiency. All this needs to be looked into and corrected. Sometimes um, even though you've had a pregnancy before, you may not have another pregnancy naturally, which is why we call it a secondary infertility. The tests, as I have mentioned earlier, needs to be done alongside a scan, and if you had a cesarean, an Eskimo seal needs to be looked at. Um, Drug intake can cause infertility, but if you have stopped it long back, we need to do these tests to figure out what is the egg counts that you have or the sperm counts that you have, and cater the treatment accordingly. It depends on which drug has it left any permanent deficits we need to look into. Next question, please. Any other questions, please? I suppose that is all. Thank you very much.